Yep. Welcome back. In the studio with us today is Vince Least. He's the president and CEO of the North Arkansas Regional Medical Center. And as a lot of people know, we're having to sign up for affordable health care, and it's become a law. And he's here to talk about some of the options here in the marketplace.
Well, thank you for having me.
You
I
bet.
really appreciate it.
I think it's important to let our viewers know what's going on.
Well, one of the things I think is really important for us to do is to talk about the factual presentation of how the private option got started. And I know there's been a lot of campaign rhetoric about it's Obamacare, it's Obamacare.
Yeah.
Well, you know, if you're gonna change Obamacare, you don't do it in Little Rock. You probably do it in Washington. So let's go back, a little history lesson here. Let's go back to 2010. In 2010, the president signed the Affordable Care Act. And in the Affordable Care Act, there were two major things that affect hospitals and doctors. One was significant reductions in Medicare payments to doctors and hospitals for the purpose of developing a pool of dollars to support the expansion of Medicaid in all the states. Now, that was in 2010. The reductions were not programmed to start until January 1, 2013. So now, in 2012, a large number of states, about 26 states, challenged the Affordable Care Act in the Supreme Court. They challenged the constitutionality of the expansion of Medicaid. In other words, they said the federal government has no legal right to tell states they must expand Medicaid. Well, the states won and the hospitals lost. I'll tell you how. The reductions in Medicaid programmed in the Affordable Care Act continue in all 50 states. So dollars are being siphoned out of those hospital payments and doctor payments to create that pool of money to grow Medicaid to a population of patients at about 138% of the federal poverty level and below. Now, what's happened so far? 26 states have expanded Medicaid. So they are now receiving a flow of dollars from the federal government's pool of money to pay for insurance for folks under various and sundry plans in those states. Arkansas's answer is the private option. Okay, so here's what happened. Medicare reduction started on January 1, 2013 for hospitals and doctors. So we went through an entire year of reductions with no way to bring those dollars back to the state of Arkansas. On January 1, 2014, the private option started. Now what does it do? It says to the federal government, we'll take your $115 or $20 million, we'll put it in a pool in the state of Arkansas. Now we'll enroll people in the state of Arkansas at or below 138% of the federal poverty level, which is about $16,000 for one person a year in earnings, and about $32,000 for a family of four. Now, we will take that money, we will buy an insurance plan off the federal insurance exchange, and we'll give it to those folks to go use. 80% of the people in the state of Arkansas are on a Blue Cross plan. That pays the doctors okay, pays the hospital okay, and what does that really mean to us? That now means that the dollars were extracted on one side are now coming back to hospitals and doctors on the other side. It'll never make up the difference. We're still going to be at a loss position. Our hospital would have lost about $19 million over 5 years had the private option not started. Now we're down to about $2 million over 5 years since the private option is working. There are 218,000 people signed up on the private option in the state of Arkansas. There are almost 3,200 people signed up on the private option in Boone County alone. Our self-pay numbers at the hospital in 2013 were running about 9%. Now, self-pay is a nice acronym for we're never going to see it. In other words, patients cannot afford to pay for that care. The working poor, the people who have no jobs, the people who have no means to pay. That number is down to about 3% now. So the people who are caring for in our community right now are folks who signed up on the private option. They're using those cards to now see their primary care doctors. So their health care is improved. So the entire Affordable Care Act was a massive redistribution of dollars. Let's take it out of the Medicare programs. Let's put it in a pool. Let's force the states to expand Medicaid, but the Supreme Court got in the middle of that. So now, where do we sit today here in Harrison? Hospitals have really become dependent on the private option. There are so many people enrolled that if those dollars go away, with the margins so thin in major hospitals, and specifically the critical access hospitals up and down the Delta or in the southern part of the state, there's going to be some major problems. Now, if the private option were to just go away today, there'd be about 218,000 people without health insurance if they have it today. So I really think that under the current conditions, the act was funded to the end of this year. Now, the governor has negotiated with the legislature and the Senate to fund it for another year, so it goes to end of 2016. And he's created a commission of folks to try to create a plan for the state of Arkansas to use these dollars in the appropriate way. And everybody in Arkansas is afraid of what happens when we start have to paying some of it. So the important message here is this. We have to be educated, we have to understand the issues. We have to understand that campaign rhetoric is one thing, but the facts are another.
Yeah.
So my message to the community right now is I thought that I'd be asking everybody in our community to contact our elected officials to do something immediately. My message right now is I just want people to understand what the facts are and how it works, and that these are dollars that are being spent in Arkansas that were essentially extracted from Arkansas and fed back through another plan. So in summary, when it comes time to understand what we have to do with our elected officials or send messages, which may be about this time next year, I want our community to understand that there's a lot of facts out there that are not necessarily openly discussed. So read up, study up, contact your elected official, and let's work together to help the community, to help the hospital, to keep my ability to attract physicians to the community, and to keep our health, local health strong.
Is there something that the hospital's doing to educate on a wider scale?
We have had, well, I've been just about anywhere anybody will listen to me.
Okay.
But we do have a sign up on, actually it's tomorrow, on the 11th, for folks to come in and bring their information and sign up on the plan. But I think that overall,
Do they have the option to choose either or?
They have, well, it really is dependent upon their income. So if they come in and demonstrate with appropriate materials that they are at the right level, then they can achieve this plan, but they're normally enrolled in Medicaid first. So that's really, I think that's really important for folks to know. Our hospital, I think, is valuable to the community for a couple of reasons. One, we're providing a high level of care. 27,000 people will come to our emergency room. Our ambulances are going to roll about 7,000 times this year. We'll have about 5,700 people have surgery down there this year. And on the other side of the coin, we have about 800 jobs and about $32 million in salaries. So think of Harrison without that, and we might be a little different community. So two roles, as an employer and a healthcare provider. And I want to thank you guys for allowing me to tell my story.
Thank you.
Absolutely. I think if you want more information, you can contact the hospital. What department would they?
You can contact me at the main number.
Call me.
You don't call me? No. Yes, just please call me at 870-414-5155, and my folks will get you all connected.
All right. If you have any questions about
Thank
that,
you
please
very much.
do that.
Absolutely.
Thank you, Vincent.
Thanks for having
Appreciate
me.
it very much.
All righty.
As always, more information is at the end of the show. If you happen to want to jot it down, you missed it, at the end of the show, you'll get more information. If you're online, that information will be there. So a lot of places. If you have questions, please contact that information out. Thank you again, Mr.
Appreciate it.
Up next, we're going to be talking with Jesse Carocchio, and he'll be talking about the new Christian radio station here in Harrison. We'll be talking about all the details about that in just 2 minutes. Stay with us. Thank you.